Today our presenters are Hallie Fader-Towe, Cynthia Kimmelman and Andrew Barbee. Ms. Fader-Towe is a policy analyst focusing on court systems at the Council of State Governments Justice Center. Ms. Kimmelman is the Director of Administrative Services at the Bronx Mental Health Court program, a Bureau of Justice Assistance mental health court learning site. And Mr. Barbee is a Senior Research Associate at the Council of State Governments Justice Center. I now turn it over to Ms. Fader-Towe.
Thank you, Elizabeth. I'd just like to give the audience a moment to complete the poll, and then we'll begin. I would like to welcome you all to Working with Data for Mental Health Court Practitioners, Part 1, Data Collection and Manipulation. Today's training will have three main components. First, I will provide a brief discussion of the policy context for data collection in mental health courts, and will emphasize why data collection is such an important part of both designing and sustaining a successful mental health court program. I will then turn the presentation over to Cynthia Kimmelman, who will give a practitioner's perspective on which data to collect and process considerations for collecting mental health court data. Cynthia will be drawing on her experience, in particular at the Bronx, New York Mental Health Court, which is one of the 5 BJA mental health court learning sites. Andrew Barbee, Senior Research Associate at the Council of State Governments Justice Center, will conclude our presentation by walking through some fundamental functions within Excel and most other spreadsheet programs that can help you organize and analyze the data that you collect. We have distributed a sample data set earlier this morning, which you can open during Andy's portion of the presentation if you wish to follow along as he describes how each of these functions work. We will conclude with a question and answer section. I would also like to let you all know that we will be holding a second part of this training with Cynthia and Andy that will focus on data evaluation and presentation. That presentation will focus on performance measures, process and outcome evaluations, and translating data into communications for different stakeholders. Please stay tuned through the monthly Consensus Project newsletter for the date and time of this session. Data touches program design and operation in many ways. At the planning phase, data allows stakeholders to select an appropriate target population and identify available resources. In program operations, data allow team members to communicate effectively with each other to identify potential program participants and link them with services. In program evaluation, data allows stakeholders to understand whom the program is serving and with what effects. Outside of program operations, data provide the necessary components for the research that develops evidence-based practices. Although I've highlighted here the importance of data for sustainability, data is spread throughout the essential elements of the mental health court. Despite over 250 mental health courts in operation today, we know surprisingly little about whom these programs are serving and with what outcomes on criminal justice and behavioral health metrics. Today's presentation will, we hope, provide you with tools not only to improve your own program's functions, but also to build the evidence base that will help the field in general understand more about this type of programmatic intervention. The first question we will address today is what data to collect. Dr. Hank Stedman from Policy Research Associates has developed a brief guide to data collection in mental health courts that lays out different types of data as well as different evaluation methods. This document is available online at consensusproject.org. Before turning to Cynthia for more specifics, I will walk through the broad categories of data that Dr. Stedman outlines. These categories will help you think about the types of data that you will need to collect. You will want data about the participants, from those who are potential participants in your program to those who actually enter the program. You want data on the services these individuals engage. Finally, you will want outcome data. As you're thinking about outcome data, there are many data elements that you can capture. A necessary first step in deciding on data to collect is convening your planning group or your core team to determine which data are necessary for program operations and which data are necessary to help you measure whether you're meeting the goals that you set for yourself. For example, if reducing rearrests is a major program goal, you should be collecting data elements to measure this criminal justice outcome. Funder reporting requirements will also be an important consideration in which data elements you need to collect. I'm now going to turn it over to Cynthia for more detail on her program and what they have learned about data collection.
Thanks so much, Hallie. So on the video slide, you had the most ideal categories and data points for which to collect information, grouped into 4 general categories: participants, services, CJ outcomes, and mental health outcomes, as Hallie just described. And while much of this data collection might seem overwhelming, as it does to me, the Bronx Mental Health Court has learned, and sometimes the hard way, what the most essential data elements are, and those that can be useful for the future depending on your audience. So I've grouped together some of the things that we have found useful also into categories similar to those in the slide above. Demographics, basically about your clients, administrative data about your program, and the client's criminal justice and mental health information. In the interest of time, I may go through some of these categories a bit quickly, and I encourage you to download the slides once the webinar is complete to use them as reference points. So demographics of your clients. Much of the information that you'll capture here is for a lot of internal purposes to help you rule out duplications in areas where there are a lot of similar names, for example. So we have a lot of Rodriguez's named Jose, or Torres's, or Smith, for example. So you want to divide out your first and your last name into separate fields. And Andy later on will show you a little bit about how to do filtering and sorting, which is easier for you to figure out which client is which. You'll capture gender, date of birth, social security number, race, ethnicity, and then if there is a criminal justice identification number for your state, in New York, for example, it's called NYSID, or New York State ID number. You also want to capture administrative data and data about your program. Basically, it's data that's capturing how your program works. So, number of referrals, and from where. Did your referral come from the judge's office, DA's office, a private attorney, for example? And here, it's very important for you to look at this information because all of a sudden, at one point during the year, you might see all of a sudden you're not getting any kind of referrals from the DA's office or from one of your other different partners. And this is a way for you to be able to track the reason or that there are actually a potential change in your referral process. Assessments by your case manager or by a doctor or psychiatrist or psychologist. And tracking the number of case manager assessments is important. There are some case managers that might be performing more case management assessments than another case manager, and this is an area where you'll be able to identify whether or not that is an actual difference or whether or not it just feels like a difference from how you're working in a day-to-day process. Also, you want to capture whether or not a psychological report was written, by whom, the date, and what their initial mental health diagnosis was. Is the client on any medications, and if so, which ones? We also, in our court, track the time it takes for a report to be written by one of our doctors, and we communicate this back to the court, which is always a very frequent question that they have for us. So They're always coming back and asking us, how long does it take from the time that you've assessed the person to place them into a program? And one of the elements that we factor into that time is how long on average does it take our doctors to write a report. Also, we track the number of acceptances, which includes the date, the month, and the day, as well as rejections, and the exact same thing, date, month. But then also for rejections, we like to track the reasons why. We track, for example, whether or not a client wants to refuse us or whether or not we refuse them for a host of different reasons. Another category, the third category of grouping your data, is basically criminal justice and mental health information, again, about your clients. You want to document the number of prior arrests they've had, and that's prior arrests prior to joining your program. This is a really great tool to look at after they've graduated. Did the number of arrests they had while they were with you correspond to the number of arrests they had prior to you being with you, and is there a difference? Something that a lot of your community stakeholders are very interested in. Also, hospitalizations. Were they hospitalized while they were in your program, and will that count towards the time that they spent with you? Also, while they're in the program, warrants, re-arrests, and any other kind of stoppage in their program or a period of time where they were no longer in treatment. Also, you want to track the programs that they went into, the name and the type of program. Was it an outpatient program or a residential program? Or were they placed in some kind of community residential housing? Additionally, you want to track their program entry and exit dates. So the dates that they entered and exited each of their individual programs. Clients may not fit in one program and might have subsequent admissions to multiple programs. Also, the date that they graduated and or terminated with your mental health court, which may be different than the date they were placed in their program, which is very important to capture. I'm going to demonstrate in a minute for you what a spreadsheet looks like that captures all of these elements and basically all three of the categories, because already I know that for me, that much data is already overwhelming, and where do you put that all in one place? Before we move on to that, however, something that's very, very important to discuss is data consistency, reliability, and validity of your data. So, hypothetical question. 5 years from now, you and all of your staff have left your jobs. You're not working in your office. You're in the Peace Corps in Africa, completely unreachable. Would anyone be able to track back, look at your records, and understand anything about your clients that you've written today? Would the initials that were entered on forms, progress notes, case notes, doctors' names, would they be readable and would they make sense? Would your acronyms that you use be the same? In 5 years from now, the acronyms that you use in the mental health field, would they even still be timely and poignant? So while free-form data is very useful in many respects and even more comprehensive, from a data collection and reporting perspective, it may not have the kind of staying power and long-lasting appearance that you would need it to be. Frequently, when you're looking back at mental health court data, you're looking back at your data longitudinally, so you're looking back over a long period of time. And the people here in 5 years that are looking back at your data might not be the same staff that are currently working with you now. Andy is going to actually go through a little piece of this in a minute, talking about drop-down menus and code books that will help you in terms of the ease of your data entry. Speaking about code books, for example, and drop-down menus. So when you're entering your data, let's talk about a referral source. We get referrals from the judge, from the Assistant District Attorney Office, from different defense counsel that is appointed to our case managers. And those are different categories, and they may have different names. We also might get, have a series of different case managers and doctors that do our assessments. And in order to track what I was addressing before in terms of which case manager is doing which assessment, we need to have specific categorical initials for those case managers. So how do you keep track of all of that? And what if one person's entering it today and somebody else is entering it tomorrow, and my name, for example, is Cynthia Kimmelman and someone enters CK, and then someone tomorrow enters CD? So to help with that process, one of the things that's very important for you and your staff to create would be a code book detailing each of the columns in, for example, Excel that you may use. And each column should be labeled with an actual column number that you've entered your data in, so like A, B, and C. And then the column label should be written out, which is basically a duplication of the column head in the field, which might seem redundant, and I'm going to show you an example of this in a second if it sounds confusing. And then you'll enter the measurement parameter. And you want to make sure that in your code book you spell everything out very specifically. So if for race, for example, you're going to do Caucasian, African American, Latino, Asian American, and assign them values of 1, 2, 3, 4 respectively, you want to make sure that you display those on your sheet. This slide is an example of how we capture a lot of the data elements I've listed above. And again, I encourage you to download the presentation at the end so that you can look at this a little bit more closely later on. You'll see the majority of the categories that I just discussed on this one page. It's a real-time tracking tool that we use to look at where our new clients are in the referral process. And that pretty column that's orange, green, and purple is whether or not a client is accepted, pending, or rejected. Andy will show you in a few minutes one of the ways you can manipulate a data sheet like this by filtering and sorting. I'd like you to pay attention to the column on the right-hand side. That's column AE, and it says primary diagnosis. And under that column, you'll see numbers 1 and 2. So what does that mean? And again, an illustration of the example is I gave this spreadsheet to somebody in 5 years from now, they'll have no idea what number 1 and 2 means. That's why we use something like a code book. And here's an example of this code book that matches identically to the slide that you saw before. If you look down to primary diagnosis, you'll see that number 1 was a thought disorder, and then we specifically list what those thought disorders are that qualify for a number 1 designation. Number 2 is a mood disorder. Number 3 is substance abuse disorder, and so on. So a code book is really useful for longevity in terms of your data. There are a few more important things to think of in terms of data collection. One of them is how do you capture qualitative data elements, and that would be text that is much longer versus something that's shorter and more pointed and focused like numbers, dates, or names, or even shorter lists. So what makes the most sense and what's easiest? And unfortunately, there aren't really any good right or wrong answers to the question. It really depends on the range of data that you want to capture. So, for example, narrative about a client's problems in their treatment program, or for us, their absolutely exhaustive list of medications, information about all the different kinds of benefits and entitlements they're receiving. The list is endless. Case studies and symptom inventories are a couple of things that are commonly asked for by our funders and community stakeholders that are very relevant to how we do our business and how we manage day-to-day. They're useful tools above and beyond the quantitative data elements that we may find compelling about our clients. A case study, for example, when given to a stakeholder, might help your program secure a very much needed ear and or meeting or conversation with a policyholder in the community. And then in terms of symptom inventories, you may want to capture these. For example, it's another area that's useful to think about when you are building your databases. Will your case manager, your doctors find a symptom inventory useful and helpful in the future? Will they use it as a training tool, for example, for your case managers? And then the last thing I want to review are basically things to think about in terms of the processes around data collection. So building team processes around this process. Most importantly, who is responsible for entering all of this data and who is going to train your staff? For example, which team members will be involved in the data collection? Is it going to be your actual court personnel in the courtroom? And do they have time to even take away from their day-to-day data entry? Will they be trained beforehand on the definition of each and every variable? How will the data be entered? Will there be code books to facilitate the data entry process? Also, is the data collected from official records, or is it client-reported data? Will the need for these new elements drive additional paperwork and forms, which is very important, for your practitioners to create and for your staff to learn how to use? And will you utilize volunteers or externs, for example, to do the data entry? And when they're entering the data, are they going to be sitting in front of a computer to enter it? Or will there need to be individual intake forms for them to capture everything that needs to be entered electronically? And what methods will practitioners use to employ to make sure that all of these elements are being collected timely and accurately? And for posterity reasons, how will you enter the data in case files, for example, your actual paper files. Do you have access to other database types, to Access or to Excel? And Andy's going to discuss a piece of that again in a minute. One method that we have found useful that's very helpful for employee performance in terms of accurately measuring how our case managers and our doctors are performing and data collection thoroughness is just really reliable data is reviewing our spreadsheets and databases for missing data. And if you have noticed on that Excel spreadsheet, there was a lot of really pretty purple cells that were listed TBD. We are able to sort by those columns, for example. Now, it's really easy to ignore data that isn't there. So if it's missing, does it even exist in the first place? And unfortunately, missing data inhibits you from creating a full and rich picture of your program and how it's working. Not to mention that if you're funded by the government, the state, or your local county or city, it makes your government funders really unhappy when you're entering data for them or having to turn over reports, and there's a lot of things that are missing. So another question for you to think about is who's going to be following up on the missing data? Weekly, biweekly, quarterly, is it even necessary? My gut feeling to you is strongly suggesting yes, it is absolutely necessary. And then is the data collection being driven by requests from different external agencies and funders, or is it for personal program use, which may help you answer that question, all of which are very important questions for you to be asking when designing data collection processes. So a summary of what we just went over. Data collection, honestly, is definitely overwhelming. I would be lying if I told you differently. It's very hard to keep all of the elements straight, especially if you've never thought about data in this way ever before. So I want to highlight a couple of just key things for you to think about when you leave this session. Number one, it's really important to have a planning meeting with your program personnel, your evaluator if you have one, and any key stakeholders in your community, meaning other different criminal justice agencies you're working with, court administration, probation, parole departments. Do your funders and state agencies require certain reports from you? And what do those reports contain? If you've never thought about data collection before, this is a really great place for you to help start thinking about these data elements that you want to capture. After your planning session, number two, you'll be able to hopefully group your data elements into categories, thinking about what you know and what you're curious to know about your clients. And if you still aren't sure what you need to know, you can take that list that I put together, demographics, administrative programmatic data, criminal justice mental health information, along with the list from the Guide to Data Collection in Mental Health Courts as a starting point. It isn't necessary to collect everything, but start with some of the elements that we outlined above, and that's a really great jumping-off place. And lastly, once you determine the data you want, you need to implement processes in order to collect it. So, who should collect it? Program, core personnel, case managers, volunteer staff. Will you create data collection forms? Use an existing system you may have in place. You may already have a database, for example, that exists in your court system. Or will you create new spreadsheets in Excel to assist in the process? Together, you and your staff will be able to determine how that data should be captured based on the processes already in place with your team. The goal is to ensure that you've captured what is most relevant to your program and to key stakeholders, and that your data is consistent and reliable for future use and for future staff, and that it is not an undue burden on your team. Proper planning and implementation will help ensure these aspects and make data much less overwhelming. Thanks so much.
Hi, everybody. This is Andy. Thank you all for joining us. We'll try to make this discussion of manipulation of data in Excel as fun and exciting as I know you all expect it to be. So what we're going to do is right now we're going to walk through a variety of functions that are available to you in Excel. When you hear the word function, you can think of that as a tool for taking data. Maybe they are counts of things, people's genders, people's mental health diagnoses. You can use these functions to analyze the differences in certain characteristics for people that you're tracking in your mental health court. So essentially what we'll discuss assumes that you've got some information that's already being captured in some kind of a database that ranges from the highly sophisticated to the very simple very simple or sometimes the better ones. But you've actually got some data in a spreadsheet, most likely Excel, that you are wanting to analyze. Perhaps you're answering questions that are being asked of you, or you just have a curiosity about what's going on in the program. As Hallie mentioned earlier, there was an Excel dummy data set that was made available over the web. Hopefully you have all been able to download that. Certainly feel free to go along through that as we're discussing here. Most everything will be presented from the perspective of Excel 2003. I realize some of you may have Excel 2007. For the most part, there is more similarity than difference, but where appropriate, I'll make an effort to point differences out in terms of where you might find things in Excel 2007. If you're using other spreadsheet programs, there's a good chance that these types of functions exist in those programs as well, but this will be limited to Excel. And don't forget Google. You can always Google any of these function or tool names. For example, you can type in Excel pivot tables, and you'll get a lot of information directing you to tutorials and that sort of thing. And certainly download this presentation afterward, as these slides hopefully will give you some good guidance. We're going to walk through some tips before we get into any kind of nitty-gritty. Again, if you have opened up that dummy data set that we made available, keep in mind that that is by no means anything approaching what would be a comprehensive data set in any one of your courts. It is made simple on purpose as we want to use it simply to demonstrate a few analytical techniques with Excel. The table that Cynthia demonstrated, I think, on slide 8 certainly would be a much more realistic example of something you'd be trying to work with. So some of the tools that we're going to talk about today deal with sorting data. In any court, for example, someone may have a question, how do the males differ from the females? Well, you might want to sort the data where you separate males into one group and females into another group. You can use multiple criteria. How about males and age group versus females and similar age groups? So you can do multiple levels of sorting the data. Filtering data is a lot like sorting data, but it allows you to hide things that you just aren't interested in looking at for that time period. Some other tools to analyze the data are sum, minimum, and maximum, averaging. Basically, you're taking things such as the prevalence of certain diagnoses, for example, or dollar amounts attributable to someone's service in a program, and you want to add those together or average those together. You might need to know the number of days between an application date and a decision date, or between an entry date into a program and an exit date from a program. So knowing the duration of time is something that we'll look at. And then finally, at pivot tables, a slightly more advanced analytical tool, but something that if you are comfortable with sorting and filtering and some of the basic analysis tools, you might want to engage. So let's go to the next slide, and we're going to start looking at some of the nuts and bolts of Excel. At the top, you'll see to the left that there's a box called Menu with an arrow pointing to the right. You see File, Edit, View. In Microsoft 2007, there'll be more shaped like buttons or tabs with slightly different names, but that is the menu, and you'll see that in all of your open Excel files. Your rows, in all of these spreadsheets, you're going to have rows and columns, and that's the fundamental nature of how data is organized. Rows are going to be the cases of information about one specific person or participant. The columns will be the different characteristics about each case. For example, in one column you'll have a first name, in another column a last name, in another column a person's age or a date of birth, so on and so forth. And you'll see in the data set that we provided for you, we have some cases identified by the case ID number, 1 through 30, and then in each column there is a different type of characteristic about each of those cases: gender, race, mental health diagnosis, so on and so forth. I want to make sure that everyone is clear. When when you're working with Excel and you're typing in calculations, for example, that will average dollar amounts, sometimes terminology can make things sound a little more difficult than they really are. And when you hear about a cell being activated, which is a phrase I might use, all that means is you have taken your cursor and you have basically clicked your cursor. So I just clicked the cursor in cell B1, and that action alone activates the cell. What that means is you can then enter some information into that cell. And so in this example here, cell A1 is the activated cell. In Excel, you'll always have a little box that tells you what cell is activated. So A1 is activated here. I'm also letting you know where the formula bar is. That will come in handy when you're looking at various calculations of data, and you're at a point where you can actually understand a formula that's creating some kind of a calculation. The formula will be displayed there, which will allow you to get in there and manipulate it and change it accordingly. Most of the things that we will look at today are going to be found in basically two options on the menu bar. The first one we're going to look at is the Tools choice on the menu bar. And if you glide over to that with your cursor and click on it, there will be a drop-down box that will open up. If you go all the way to the bottom of it, it will either be fully opened up or you'll just click on two double arrows down to fully expand it. But you're looking for a choice called Options. I'm going to show everyone a couple of little things that just after many years of experience using Excel and doing analysis, I find very handy. If you're using Excel 2007, to get to the options, you would click on the Windows icon on the far left of the menu bar, the toolbar. And when you click on that Windows icon, at the very bottom of the window that opens up will be a button called Excel Options. You would click on that and then navigate in the pane that you'll be presented with to Advanced. Okay, so hopefully everyone now has had an opportunity to click on the Tools Options. In 2003, Excel 2003, if you've done that, you'll be given a window that opens up, and you want to activate the tab that is titled Edit. By default, Microsoft Excel will check that first box under Settings that says Edit directly in cell. I would suggest that you uncheck that box. The reason really is kind of nerdy and long-winded. Basically, unchecking that box takes a lot of the busyness away. So when you're trying to do formulas and change formulas, it's just a lot easier and straightforward to do that with this box unchecked. The next tab that I want you to become familiar with is on the toolbar under the choice called Data. In Data, we will be seeing, that is where most of the little tools that reside that we're going to look at today. The sorting tool, the filtering tool, and a little bit further down, the pivot table tool. In Microsoft 2007, the pivot table tool is in a button called Insert. That is the difference there. Here we're looking at the dummy data set that was made available. Again, row 1, in this instance, you'll notice that it has the titles of the various variables in the data set. So in column A, row 1, you see case ID. In column B, row 1, you see start date, so on and so forth for the data set. That's commonly referred to as a header row. And you will see that terminology in a couple of the things that we look at today. There are 30 cases. You'll see that each case has a case ID, a start date, an end date, so on and so forth. Again, these are all made-up values. The case ID, the last name, all the way through race, those variables generally are going to be useful as unique identifiers. So if you're working with a large data set that spans many years of mental health court's operations, it's possible that the same person may come in and out of that program, in which case what would allow you to identify one episode from another would be the start date and end date. So those are kinds of information, as Cynthia alluded to, that are very important when collecting data. So the first thing we're going to look at is sorting data. So if you're working with the dummy data set, you will want right now to highlight that entire data set. So you can highlight beginning in A1 and just click with your cursor and hold all the way down to J31 so that you highlight the whole data set. You'll then navigate on the toolbar to Data, and then under Data, you will select the option of Sort. Once you do that, a little window will pop open, and you'll have three choices. In each of those three choices, there's an arrow pointing downward that allows you to open a drop-down box. And in that drop-down box are the different column headers: first name, age, gender, race. For this example, let's select gender, and we'll only do one sort. So once you click on gender, you'll want to make sure that below that, where it says My Data Range Has, it depends on how you selected your data. If you selected everything, even the header, then you will select My Data Range Has a header row. And then you will click OK. And what you get is a data set that is sorted by gender. So the females are on top, the males are on bottom. That was sorted alphabetically. You can do it the reverse. It just depends. So we'll quickly step through sorting up to additional criteria. And I'm going to step back one slide. So once again, you'll highlight all of the data. Once the data is highlighted, you will go to to Data on the toolbar. Click on that and select Sort. Once again, in the first option drop-down box, you'll click on Gender. In the second option drop-down box, open it up and select Mental Health Diagnosis. Leave both of them pre-selected as ascending, which means alphabetically in this instance. And when you hit OK, you will get a data set that is first sorted by gender and then second sorted by mental health diagnosis. So what you'll see is in this first group, we have females, and then within the females, there's a sorting by the different mental health diagnoses. And then the same thing is repeated for males. Now let's look at filtering. And this is basically an extension of sorting data. It just gives you a slightly different way of looking at it. Once again, you'll want to highlight all of your data, navigate on the data choice on the toolbar, and click on Filter. In Microsoft 2003, you will be given the choice of Auto Filter versus Advanced Filter. Simply check Auto Filter. In Microsoft 2007, there's a button for Filter and then a separate button altogether for Advanced Filter. Just choose Filter. So once you've done that, your data will look like this, and it will have these various arrows pointing downward at the right of each of your header columns. And what that allows you to do is choose how you want to sort the data based on what is possible in any given variable. And so this example is showing that we want to filter the data based on mental health diagnosis, and we are selecting the bipolar category. And so once we do that, it will show us only those cases that have a mental health diagnosis of bipolar. You can repeat that for any given diagnosis that you may want to look at more closely. To once again look at all of them, you simply click on that down arrow again and select all. Now we'll quickly go over some basic calculations that you can use in Excel. Assume, just for discussion purposes, that you had a cost unit associated with each of these participants in the mental health court. And I realize these are not realistic costs, but again, it's just for discussion. And you wanted to know the total cost of all 30 of these participants during their service in the court. What you would need to do is simply find a cell that is not already filled with information, any blank cell, and you're going to type a calculation, a formula into that cell. So you would simply activate your desired cell. In this instance, it's column, I'm not sure, it's the column right before G, F, and row 33. And so you're literally going to activate that cell and type the equal sign. Then you're going to type the number SUM. And then within parentheses, you will have the various numbers, in this instance, dollar values, that you want to sum. And so the formula structure is equals sum, open parentheses, number 1, comma, number 2, comma, and so forth, with a closed parentheses. Each number is a cell in your spreadsheet. For example, in our spreadsheet, the first number will start with F2, and it will go all the way down through F31. Now, when you're going to run a consecutive and continued span of numbers with no breakup in between, you can simply type a colon between the first and the last number of that span. So in our example here, we're going to type in equals sum, open parentheses, F2, colon, F31, close parentheses. And you'll hit enter, and that will calculate the total cost for those groups. You'll note that once you have hit enter, you should see $1,875 appearing in that cell. That is the product of the formula, and the formula is what is actually typed into the cell. And in the formula bar above, you'll see the formula that you typed into that cell. And the formula you need to keep in mind is indeed what is actually in the cell, but it shows you the product of it anytime you enter a formula. You may want to know the average of these costs. Well, the formula is exactly the same, but instead of the word sum, you would simply type the word average. But the basic format is exactly the same, and you'll see here when you do that, you get the average of those dollar expenditures, which was $62.50. If you want to know the maximum dollar value in that span of numbers, you would type max. If you wanted to know the minimum, min, or the most frequent cost, you would simply type mode. And these are some handy examples of different kinds of calculations that are fairly easy to use in Excel. One that's just a little bit more complicated, and it's just a little bit different way of thinking, is the span of time between days. And it's really pretty simple for the most part. You would simply subtract one date from another date. So in this example, we have program ending dates in column C and program begin dates in column B. And you would simply subtract one from the other in order to determine the number of days between the two. Now, there's a computational nuance to Excel. It's common with a lot of databases and spreadsheets, where when you do this, it actually does not count the latest occurring date as part of the product of the difference. In other words, if that person was actually served on the 15th and released, it's not counted as a day of service. So you have to basically modify the formula in order to get that to produce the kind of product that you know. And it's going to depend from one program to the other. Odds are you will want to count the 15th itself as a day of service so that you have 15 days spent in the program. Now we're going to look at pivot tables, and we will have to jump through this a little bit quickly. This is where downloading these slides afterwards will come in handy so that you can reference this in the future. Don't feel bad if when trying to do pivot tables on your own, it becomes a little bit confusing. The less experienced one is with Excel, it's going to be a little bit more difficult. But with some practice, I'm sure that you can get it. So as with everything else, you'll want to highlight your data. And once you've done that, navigate on the toolbar over to the choice data, and and then you'll select Pivot Table and Pivot Chart Report. In Microsoft 2007, you will choose the Insert tab on your toolbar, and then you will choose Pivot Table. What will open up is what's known as a wizard, and basically this is a process for guiding you through how you will build a pivot table. So you have already pre-selected your data, and so it's going to default to the first choice of the first question. You are going to be analyzing Microsoft Office Excel data. On the second question down below, you want to choose Pivot Table. And I would suggest for those of you, once you become expert with Pivot Table, you can then go to Pivot Chart Report. Once you have answered those two questions, then the second part of the three-part wizard will ask you about the data that you want to use. And what you'll need to do is click your cursor in the box just to the right of the word range. And once you have activated that cell, you'll then have to go back and reselect all of your data. And it will allow you to just literally use your cursor and highlight the data once again. Once you've done that and you hit Enter, the final step of the wizard is going to appear and ask you if you want this information to be a new worksheet or presented in the existing worksheet. I believe that having it sort as a new worksheet is a much cleaner way to look at the information and manipulate. So select New Worksheet and then click Finish. Once you have done that, you're going to be presented with basically the framework for what will ultimately become a tabular display of certain kinds of information. Now, we probably should have addressed, but we can do it here. Why would you want to use a pivot table? If someone comes to you and says, I'd like to know what the diagnoses are by gender, you could do that with a lot of hand counts, or if you know how to use pivot tables, pretty quickly. And so that's what we're going to answer right here. So the first thing that we're going to do is go through the process of selecting where you want the variables to be reported in your pivot table. For the drop row fields here portion of the table, we're going to select gender. And the way that you would do that, you would simply click on gender and keep your cursor pressed down and literally drag it so that it's hovering over the area that says drop row fields here. And you would literally unclick your cursor and it will drop it there. You then want to go into your pivot table field list on the right and do the same process with mental health diagnosis, but instead drag it where it says drop column fields here. Once you do that, you'll see the basic framework set up so that you have gender on the left going vertically and mental health diagnosis. What I just explained, and this is part of the difficulty with pivot tables, but what you're actually going to get will have the opposite of what I said. Mental health diagnosis on the left going vertically with gender on the right going horizontally. Then you will need to select either gender or mental health diagnosis and drag it into the middle of the pivot table where it says drop data items here. That will allow it to actually populate, and you simply need to choose one of the two that you used to build the row heading and the column headings. And so what you'll see here are the final evaluations by gender and mental health diagnosis, the cross-tabulation of the 30 cases. You can also, with a pivot table, add a component to add one more layer. In this instance, we're taking race and inserting it into the top of the pivot table where it offers drop page fields here. And so, for example, if you choose Asian, there were 7 Asians. They were all male, and their breakdown by mental health diagnosis was as follows. I turn it over now to Hallie.
Thank you, Andy. Thank you, Cynthia. I hope everybody found that as informative as I did. And as Andy mentioned, all of the steps and the slides will be available on our website after this presentation. And you can also use Google to look up functions if you want more details on that. I'm just showing you right now some additional publications that we have on data collection and mental health courts, and reminding you that the webinar and PowerPoint will be available on consensusproject.org. Before we go to a couple of questions and answers, I just wanted to remind you all that Andy and Cynthia will be coming back and walking through data evaluation, where we're going to talk about performance measures, process evaluations, and outcome evaluations, as well as constructing communications for different stakeholder groups based on data. So looking at a data set like the analysis that Andy has just done and figuring what types of charts might be helpful or presentation tools might be helpful. Finally, I just wanted to make you all aware of a pilot program that's going on right now through the National Center for State Courts on performance measures for mental health courts. And that program should have results out this fall, so we'll definitely keep you informed about that. Thank you all again for your attention, and I'm going to turn it to Elizabeth to moderate our questions.
Great. Thanks to all the presenters for such a great and informative presentation. We have time for just a few questions, and a few of you sent in really great questions, so I'm going to start with those. We had a question come in during Cynthia's presentation. Social Security number, while a great identifier, can make people nervous when collected. Is it advisable to use another number, for example, a probation ID, a rap sheet ID, or a self-generated number?
Absolutely. And if you go back to slide number 8, where I have the example of the Excel spreadsheet, the very first column you'll see is task ID number, and that's the internal document number that we use to track all of our clients, how our paperwork is filed in filing cabinets, and so on and so forth. In addition to the spreadsheets that I showed you online, we also have an Access database where we capture a lot of other information about our clients. It's not all done within Excel, and in that Access database, we're able to generate different reports and things by program, et cetera. We keep the client's Social Security number in that database, all of which is password protected and encrypted, so it's not actually out there in the world in an Excel document that we use every day that all of our staff uses. So absolutely, we would never really use their Social Security number except to verify things with Medicaid, with the court system. If their New York State ID number is not coming up in the way it should be, they're able to help identify our clients if we need information about them with their Social Security number and their date of birth. So I would definitely encourage you guys to create a self-generated number.
Great, thank you. And we have another question, Cynthia, I think this is best directed to you. Can you suggest additional ways to track participants after they've successfully completed a mental health court? This attendee mentions that she tracks them in 2 ways. The participant remains a client of the same treatment provider, or they schedule a time to check arrest or court records. But after those 2, she hits a wall and would love any additional ways to track participants.
We have actually hit that exact same wall. There seems to be a lot of difficulties for us. And then also in terms of staffing, the manpower of someone who can go back and double check and see whether or not somebody has been readmitted to a program or been rearrested, and not all of that data is publicly available that's available to us. So that is actually something that we have also been struggling with. We do occasionally get clients that are readmitted into our program, and we check all of our databases to see if they exist, number 1. And then number 2, we do have close relationships with a lot of the different programs, but to be honest, we're not doing a very thorough or we're not doing a very comprehensive job of keeping track of our clients. One of the things we do that is a requirement in terms of the federal funding that we receive, all of our clients fall under some kind of grant, and that grant requirement is to do an interview with them, a baseline kind of interview about their mental health symptoms, employment, entitlements, and so on and so forth. at the time they come into the program at 6 and at 12 months. So for each client, we collect a data sheet on what's the best way to contact them, what are some of their hangout points, family members that are close to them and their contact information. So we have a sheet that gets filled out when they first enroll into the program, and then each time we do that interview gets updated on how to contact them best. And we don't have a process in place right now to really follow up on that going forward, but we do have the information so we're able to track them down, find out how they're doing. That's probably
great. Thank you so much. And then we have a few questions that I think would best go to Andy about the differences in using an Access database as compared to an Excel spreadsheet.
There's quite a bit of difference. With Access, you're going to be able to have it combined more with what is typically thought of as a case management system. For example, it may be smart to group different kinds of information about the participants in a mental health court. One group of information would be basic demographics. Is this a male or a female? What was their birth date? Where do they live? Information such as that. Another group of information would be results of an assessment process. How did they score using this tool to identify mental health issues? What are their recidivism risks based upon this risk assessment instrument? With Access, you can develop more devoted spreadsheets, if you will. With Access and that kind of database, what you're really talking about are called tables. And you can have tables, which are basically, they look like spreadsheets, but they're devoted to certain kinds of information. They fit more in line with the way case management philosophy is, which has to deal with a lot of storage issues. But there's quite a bit of difference. Everything you can store with an Excel spreadsheet, you can also store with Access, but a whole lot more with Access. You can combine information in different ways when it's coming out of Access, whereas with Excel you're kind of limited to a very linear approach, and you have to really put everything in one big file unless you come up with a way that would force you to throw it into something like Access anyway. I hope that helps.
Thank you so much, Andy. And then this is directed to all the presenters. In terms of in terms of data collection, how long should a mental health court be established and up and running before you start to analyze the data?
Well, just real quickly, the sooner the better. It may take a while, a year, for example, before you have what's needed to do outcome evaluation, where you track people for 6 months after starting a program and seeing how they're doing. But in terms of process evaluation, which we'll get to in a later webinar, when you're just trying to make sure, okay, we said we were going to collect information about people that come through the program. Are we? Well, one quick way to evaluate that is to just start looking, within a month or two of supposedly beginning a system. So if you began in September, there's no reason why in December you can't start looking at, okay, what did these last 2 months look like? We know we have about 50 people a month that come through. We should have about 100 cases of people with this basic set of information entered. So it's really never too soon, depending upon what is the question you're trying to address.
And we have found, and when I have said that we have learned about this sometimes the hard way, we have different people that have asked us for different kinds of information that going back to when we very, very, very first started, we don't actually have, which has been really problematic. There's no way for us to really get that data except for pulling individual files from storage, which is costly, becomes very expensive very quickly. But yet, unfortunately, when the court was first designed, there were some data elements that no one thought to really put together, a lot of which were in the list of everything that I presented. And a lot of that, again, was driven by reports that we were getting from different state and local officials that we had to complete. Now, I agree with Andy as well that one of the other ways that we use our data is to track, for example, case management assessments, or what is our current active caseload at this time. That's an important number, and that people ask us all the time. And it's never too soon to start pulling together that information, even very, very basic, simple kinds of things, like just adding different kinds of categories.
Great, thank you. And given that we've already gone over, and I thank everyone for staying with us, I'm going to ask one last question, and then we'll finish up. This, I think, may be most appropriate, Hallie, for you. Given that these data collection documents are very important and necessary, how do you ensure the confidentiality of the individual's personal information?
I'm so glad that came up because it is, we talk about these data elements for analysis, and they are important in that respect, but there are also individuals and often individual health information, which, as this audience I'm sure is familiar, is protected by federal law for health information under HIPAA and for substance abuse treatment information under 42 CFR Part 2. And it may also be protected under state law. So one of the things that you'll want to consider as you're setting up your data collection processes, and I think Cynthia can probably talk to this, is the types of permissions that individuals in your program might give when they participate in the mental health program. So if they're already signing an authorization for sharing information, ensuring that that authorization includes the different parties who would need to use the data for your program. And here you're going to want to be less inclusive. You're going to want to be minimally inclusive, so we're not sharing data with the whole world. We're sharing it really with the people who need to share it. I also need to point out that HIPAA has security provisions in it, and so there are rules about ensuring that the systems that collect personal health information are password protected, and so you want to talk with somebody in IT about making sure that you're keeping the data secure.
Great. Thank you so much, and thank you, everybody, for staying with us past 3 o'clock today. This concludes our webinar on working with data for mental health court practitioners, Part 1. As Hallie mentioned, we will be having a Part 2 of this webinar series, so stay tuned for a Consensus Project announcement about the date and time for the next session. And I just wanted to thank you all for your attendance and participation. And I wanted to thank the Bureau of Justice Assistance for sponsoring the event, and a big thank you to our presenters. And a recording of this presentation and the PowerPoint slides will be available online in the next few days on our website, which is www.consensusproject.org. And finally, when you leave this event, a brief survey on the webinar will pop up on your screen, and we would very much appreciate your feedback. Thank you so much.